And so I think the next item that we had was Rachel was going to lead us in her research corner.
Yes, I'm gonna start sharing my screen. Michelle brought up a great point of prevention in primary care, and that's exactly what this research article is about. And so hoping that based upon Michelle's kind of presentation and then this article, we can have a really great kind of discussion regarding pain and treating pain or prevention of chronic pain. So the idea with this article was really just answering that question. How can pediatric integrated primary care help with chronic pain prevention? This was an article that was published in Clinical Practice in Pediatric Psychology. I will show that reference at the end. But, the setup, of course, obviously, we know chronic pain is a significant problem, and there's some data to suggest that it shows up in a decent chunk of primary care appointments. 20 to 40% is the estimate. So again, thinking about how can we reach those kids, how can we target those kids who are coming into primary care with chronic pain. So the authors actually kind of present a model, integrated prevention model for pain. So I'm going to kind of go through point by point, and we can talk a little bit about, how to kind of implement this prevention model. Of course, at the bottom you'll see is the universal primary care prevention, right? So our primary care physicians that are screening for chronic pain or associated conditions, risk factors, things like internalizing disorders, things like that, providing support, anticipatory guidance, all the stuff that they do quite well. And then the tier up being a little bit more targeted with the prevention. So that's where the mental health professional or behavioral health consultant kind of comes in. Monitor, once we kind of identify those kids at risk for chronic pain or currently experiencing chronic pain, monitoring with the medical team, providing some sort of brief intervention. The authors give an example actually of a CBT group, doing kind of joint visits with the PCP, and then referring out, as was discussed before, to a specialty care. Is there a pain program or is there a pain focused psychologist for those kids who need more specialized care? So kind of talking through these aspects. When they talked about universal prevention, obviously they're talking about, let's screen for this and well child visits, routine visits, some questions that perhaps the primary care providers can be asking of children and families of, do you experience headaches and stomach aches? Do you experience pain frequently? To get at the functional impairment piece, does pain get in the way of doing things that you enjoy? So, one or two questions, kind of brief screening questions to implement. Some of the barriers that they talked about in doing something like this, of course, is acknowledging that during routine visits and well child visits, there's tons of screeners already that we're giving. Are there too many screeners? How can we kind of make sure that we, can put this into your workflow? Do we have enough time to manage this? And then the other piece of the competency and confidence to manage. So once you ask these questions, do you feel as a medical team that you can manage and potentially treat or refer? So those are some of the barriers that they discussed regarding universal prevention, and kind of acknowledging that universal prevention for chronic pain in kids may not be happening, or that kind of screening at that level might be something that isn't maybe missing in routine visits. And then getting into targeted prevention, which is where the behavioral health consultants can come in. So, more targeted prevention is finding children and families who are having the moderate levels of either risk or distress from pain. So they actually give an example of a screening tool that could be used. And they walk through some a kind of intervention that they implemented in their IPC clinic. This was a group 4-session CBT, so very brief, very focused intervention with psychoed, behavioral activation, relaxation, cognitive restructuring, things of that nature. And then the authors kind of talk through, again, barriers for this. So this requires much more resources and time and costs, of course, associated when you get to this level of targeted prevention. Is this something that can be offered in the clinic? Is there buy-in? How do we get this more specific screening tool integrated into one's practice? And then finally, you have clinical treatment. So the specialty care. And so this being reserved for the kids that are experiencing higher levels of distress, functional impairment. One marker of this, of course, could be many sick visits to the clinic related to chronic pain. So again, the role in this of the medical team would be to discuss the rationale for referral to a pain management team or a pain psychologist and help to facilitate that referral. Of course, the barriers to this would be accessing that specialized treatment. So I think as a discussion that Michelle brought up earlier, if you go out into the general community and you're making a referral, I mean, there's not going to be many specialty pain psychologists, right? And so do we have access to that specialty care? I know there are also kind of multidisciplinary pain programs. I'm thinking of one, I think maybe CHOP had one. So there's some kind of pain, really specially multidisciplinary programs, but vast majority of patients may not have access to, or we may not be even aware of those resources. So how do you find those kind of specialty programs? How do you get access to them? How do you facilitate that referral for the family? So they talk a little bit about that aspect. So this article is really kind of outlining where can behavioral health consultants, where they come in terms of chronic pain prevention in primary care. And kind of the bottom line is they can certainly help prevent, and even there can be some kind of more targeted treatment done in primary care. So I'm going to put this reference in the chat for people to kind of look up the article, and hopefully we can maybe start the facilitated discussion about targeting chronic pain. If people have done that, we can even also talk about acute pain. So that wasn't really the scope of this article, but people's use of screeners, pathways, interventions, barriers, facilitators, all that good stuff.